One more. Perfect. All right, guys. Hey, Dr. Randy. Got Nick in the office. So, hey, I wanted to shoot this video on him because he's doing, what percentage better would you say? Are you back to 100%?
Yeah.
Or
100%.
not quite there, you're 100% better. Okay, so you came in with neck and shoulder pain. Were you getting some headaches too?
Yes. Okay,
so all that's cleared up. So he's been doing really well. So we're gonna do an adjustment video on his treatment. You're a machinist, so were you on your feet a lot? I'm trying to go back through almost his first visit. Like, this is a history that we would have normally taken on his first visit, which we did, but it's been a while since then. So are you working like in, head down, sort of like in a forward posture, or how are you at work?
Yeah, on my feet a lot and looking down, like you said, a lot.
Okay, so that's problematic. He's on his feet a lot, which can irritate your low back, especially if you're on a concrete surface. But in his case, he's a machinist, so he's kind of looking down, doing work with his shoulders rounded, head flexed. That adds up day after day, month after month, year after year, where it can take its toll on your spine, especially your neck, because as I've talked about a lot, we're all supposed to have this lordosis in our cervical spine, where it's this 45-degree curve back. Okay, so I x-ray people every day, almost every new patient in the office, and I can tell you that almost nobody has that good curve. And part of the main reason is we live in this technological sort of society. We're on our screens a lot. Or in his case, it's not even that, it's just part of his job. So if you're at a desk, if you're doing a lot of computer work, doing a lot of paperwork, desk work, if you're in the car a lot, especially because your head's forward, whether you realize it or not, you're losing that good arc, that good lordosis, that 45-degree C curve we like to see from the side picture, and you're probably more straight, or even I see a lot where it's forward. And what that does is crush the disc in between. It irritates the cord and the nerves. It causes a whole host of problems in the neck and upper back, thoracic spine, that we can sort of correct with adjustments and prevent that forward head, anterior head carriage. And then, a big thing that goes with that is the exercises that we'll give you at home to do to help correct some of that too, so you can sort of retrain that neck to come back. All right, so let's go through. All right, so kind of we started doing a little bit on him before we started, but I'm just gonna get into some of the knots in his shoulder. Let that arm relax for me. Good. And for him, because it was neck and right shoulder, CT junction adjustment. Good. Now, were you originally having pain in your arm, or was it all kind of localized back here?
Shoulder.
Localized to the shoulder?
Yep.
So we see a lot, and this isn't necessarily him, but we see a ton of shoulder problems where people are feeling the pain in the front. I kind of have to go through this with everybody that comes in, and we do our shoulder exams, but more than 90% of the time, the overwhelming cause of the shoulder pain, even though it's felt out maybe lateral in the deltoid or more anterior where your rotator cuff tendon ligaments attach, the problems back here, whether it be thoracic spine, joint dysfunction, rotator cuff muscle dysfunction, trapezius muscle dysfunction, scapular movement. So a lot of the work we do to help with shoulder problems back here. And people are always kind of saying, well, the pain's up front. But once we clear this up, that allows the muscles to fire and function and takes pressure off the tendons and the ligaments of the shoulder. Go on your back for me next. All right, my man. Cross his arms, slide down towards me. Take a nice deep breath in. Exhale, drop, drop, drop. Good, one more. Good, there. And just relax your head and neck. Perfect. Just relax your shoulders. That's it, buddy. Perfect. And this way. The same thing with that neck relax. Excellent. Pick your knees up. Pick that head up for me. Let it drop. And relax all the way down. Good, Nicholas. Got a little traction here for him. You okay? Mm-hmm. your hips while you're here. Go on your side, facing me. Put this on, yeah, there you go. Disarm them. Just laying, deep breath. Exhale, relax your shoulder. Good, other side. Deep breath in again. Exhale, just relax your shoulder. Perfect. Face down one more time. So to make sure we got some really good movement in his neck and his low back. And I adjusted him before we started filming and got his mid back to move. But to make sure we really get good scapular movement, good thoracic movement, and all these restricted joints, I'll add some drop at the end here. So we love these drop tables because I can just apply a little bit of pressure. The patient's only feeling, just a tiny amount of pressure. But when you add the drop in, it still is very comfortable for the patient, but it creates a profound adjustment, a profound effect on the movement of these thoracic spinal joints. So I can get a lot of extra work in on the upper thoracic spine without having to put the patient under a lot of extra twisting or cracking or popping. Good. And again, better movement through here is going to equal better results out into his shoulder and neck. Come on up, adjust your shoulder and you're done. You can face your chair. Thanks, Nick. Here we go. This arm relaxed, let it kind of drop into my hand. Okay, so that's his neck and shoulder adjustment. Thanks for letting us do that. And so if you're having shoulder pain, neck pain, upper thoracic pain, which is so common, probably our most common complaint in the office, we have great results with what we love to see in the office. Thanks.